The eyes are the windows to the soul. Literally, the first thing you notice when you look at somebody is their eyes. So, in the age of wearing masks and everybody being on Zoom, of course everyone's noticing their eyes. And one of the most common things that happens as we age is that we get some hooding of the upper eyelid. That skin starts to get a little more elastic, starts to hang down a little bit more, and that can be one of the first tells of people aging. Today we're going to talk about what that means and what to do about it. I'm Dr. Peter Vila, and I'm a facial plastic surgeon. The eyes are usually the first place that people start to show their age. As we get older, some people even in their 20s and 30s start to develop a little bit of hooding in the upper eyelid, and they may get some of the lower eyelid changes as well that come with aging. Now, we're going to focus on, in this video, on the upper eyelid, okay? To address that, we have to understand what it is that's going on. So as we age, the skin, and you can feel it, it's very, very thin. That upper eyelid skin is some of the thinnest skin in our body. So it's very delicate. And what happens is, as we get older, it starts to stretch out a little bit more, and it creates a little fold here. Now it gets to the point where women who are used to putting makeup on that part of their eye, eyeshadow, are no longer able to put it on there because the skin is hanging down so far and it actually covers it up. In extreme patients, it can actually obstruct your vision because it hangs down so far that it's actually covering up your visual field as well. So that brings us to the first question, which is, does insurance cover this? For the very small percentage of patients that actually have visual field obstruction from the skin hanging down over the eyes, that is something where insurance will cover it in that case. Now, you need to have your visual fields formally tested, and honestly, after the insurance and the co-pays and the deductible that you're gonna have to pay, it's not going to be that much cheaper to go through your insurance. But if that's something that's very important to you, you can certainly try to get it done through your insurance. And if you do truly have visual field obstruction, it will be covered by your insurance. For the majority of people, it's not that bad, and so your insurance will not cover it. Now, it's very important at this point to tease out whether it's just skin over the upper eyelid that's obstructing your vision, or if you actually have eyelid ptosis, meaning your eyelid itself is drooping down. And so there's a couple different ways to detect that, and your provider should definitely alert you to that if there's differences between the eyes or if one might actually be causing the problem. So if there's eyelid ptosis, that's a ptosis repair is what you would do to fix that, and not a blepharoplasty. A blepharoplasty is simply to remove skin above the eye and the upper eyelid to give you a more youthful, refreshed appearance. Now, if you just do a quick check at home, if you look at yourself in the mirror, you'll be able to see that there's a certain distance between the pupil and the upper lid margin. And that distance should be more or less the same between the two eyes. If it's very, very different, then maybe you had an accident as a child, or maybe just as you've aged, you've developed some ptosis of the upper eyelid, which is very different than just the skin hanging down and obstructing your view from the outside. So it's important to kind of tease those two out and to keep them separate. So in terms of who's a good candidate for the procedure, it really comes down to looking at the anatomy and thinking about what it is that we're treating with the blepharoplasty. If it's just eyelid skin where the skin is hanging down and you would like to get a more youthful, refreshed appearance, that's what a blepharoplasty is. If you do have eyelid ptosis where the actual eyelid is hanging further down, then you need to do another step, which is called a ptosis repair. Now, your plastic surgeon may or may not do that, so it's important to tease that out and just ask them about it, because some people do a blepharoplasty at the same time as a ptosis repair and some don't. Now, if you look at enough pictures of celebrities, you'll see that men tend to continue to age, even if they're very famous actors, and women tend not to. And why is that? It's not magic, it's because they're getting surgical procedures, maybe some non-invasive procedures to keep themselves looking youthful. So some of the people that have had maybe not so great changes after upper eyelid surgery and surgery in the upper half of the face are people like Kenny Rogers, for example. And Kenny Rogers, what happened there is that he had a very aggressive blepharoplasty, but he also had what's called a brow lift, and the brow lift actually lifts up the eyebrows. So in a man, you have to be really careful with that procedure, because if the eyebrows come up too high, you can look surprised. You can look just different than you normally do. For men, it's usually pretty good to have a pretty low set brow. That's sort of a defining male characteristic. So on the flip side, for a woman, having the brows a little bit higher up is actually a nice feminizing characteristic. So you just have to be careful with that in men. In men, you can absolutely still have a blepharoplasty. We as a society tend to accept a little bit more upper lid hooding in men. That's kind of a feature of men that we've come to accept, and tend to be less accepting of it as women. And so in women, you can be a little bit more aggressive with the upper eyelid, and you just want to avoid hollowing out the upper eyelid. So if you go too aggressive with an upper blepharoplasty, really the only risk is that you have hollowing of the upper eyelid. That is something that's correctable with filler, but in my hands, I'd prefer not to do that to begin with. So you just have to do it conservatively and tastefully. Now, in terms of how the procedure is done, if it's just a straightforward upper blepharoplasty, all that is basically a skin excision of the upper eyelid. Now, as far as how to do the procedure, this is an in-office procedure. So usually what I'll do is have them come into the office, very carefully mark out and measure the incision, and then we'll inject local anesthetic to numb everything up and perform the surgery. The sutures stay there for about a week, and then after the sutures come out, you'll see a little bit of redness there that'll last for maybe another week or two, but that's all easily covered up with makeup. It's overall tolerated very well, and people typically don't need prescription pain medicine for this. Now, just like any other surgery, of course, there is a scar. One of the tricks we have as plastic surgeons is to hide the scar in places where you don't know to look for it. So everybody has a lid crease right here. And so what we use is that lid crease as the part of the incision, and so that's where the scar ends up staying. After about 3 months after surgery, when that scar has really finished healing and flattened out, it's going to be really difficult to find that scar. Now, when you talk about sort of risks of a blepharoplasty or maybe changes that you don't want, if you look at somebody like Renee Zellweger, for example, when she has basically sort of male brow position where it's a little bit lower, and it looks great for her. That's just something that you don't typically see in women. So for her, that was a very unique defining characteristic. After she had a blepharoplasty, it completely changed the shape of her eye, because now all of a sudden you could see her eyes. So again, that's something that can be corrected. And if you look at later photos of her, she's actually gone back to looking more normal again. But right after surgery, it definitely looked like she had a very different shaped eye, which for somebody who that is their defining characteristic, if you change the shape, it's very noticeable. And somebody who is not maybe attuned to plastic surgery is going to be like, wow, why does she look so different? And the answer is because of the upper eyelids. So in patients like that, you have to have a very careful conversation based on what the expected changes are and how you're going to look after surgery. Most people aren't going to have that issue because most women don't have such a low brow and hooding of the upper eyelid. Overall, it's a very well tolerated procedure. It takes about an hour to do in the office, and it's a very easy recovery. So it really is a great procedure to get you looking refreshed and more youthful. And especially when we're all staring at our eyes these days, seeing ourselves in cameras on Zoom, it is a really nice thing, and it's a very popular procedure these days. Thank you very much for your attention. If you enjoyed the video, please like the video, and I will see you on the next video.